Welcome back to the podcast. Today I want to talk to you about a video I watched recently by Dr. Sunil Dand that really got me thinking. Dr. Dand is a physician, but he says something quite striking in the video. He doesn't trust doctors, even himself. That's a bold statement coming from someone in the medical profession. He goes on to explain that he feels this way because he believes the current medical system often focuses more on treating symptoms with medication than on addressing the root causes of health problems. He compares doctors to pawns of the pharmaceutical industry, suggesting that medical training today emphasizes prescribing drugs over truly understanding the complexities of human health. Dand argues that medical schools do not adequately educate future doctors about the critical role of nutrition and lifestyle factors in preventing and managing diseases. This lack of emphasis on holistic health, he argues, leads to an over-reliance on medication for conditions like type 2 diabetes, which could potentially be managed through lifestyle changes. He uses the COVID-19 pandemic as an example, highlighting how the medical establishment implemented large-scale changes like lockdowns when deemed necessary. He questions why the same level of action isn't taken to address the prevalence of unhealthy food and its impact on public health. Dr. Dand proposes 3 key changes to improve the healthcare system. Revolutionize medical education, particularly in medical school, to emphasize the importance of nutrition, well-being, and the distinction between whole foods and processed foods. Enforce greater transparency by requiring doctors and hospitals to disclose any financial ties they have with pharmaceutical companies or other entities that could influence their medical decisions. Implement stricter regulations on physician societies to limit their acceptance of funding from external sources, especially pharmaceutical companies. He even suggests a bold move: banning all pharmaceutical advertising in the U.S., similar to what many other developed countries have done. Dr. Dand believes that patients must take an active role in their health as well. He encourages patients to become more informed about their health conditions and treatment options, engage in open communication with their doctors, asking questions about potential conflicts of interest, and actively participating in decision-making. Adopt healthier lifestyle choices, recognizing that doctors aren't miracle workers and that individual choices about diet, exercise, and other factors significantly impact overall health. Dr. Dand emphasizes the need for a true partnership between patients and doctors, working together toward a common goal of optimal health. He challenges the notion that doctors are powerless to address broader societal issues impacting health, using the pandemic response as evidence of the system's ability to implement change when needed. He is particularly passionate about the role of food in health, expressing disbelief at how little some doctors, even oncologists treating cancer patients, discuss the impact of diet with their patients. He advocates for a return to whole, unprocessed foods and a reduction in sugar and unhealthy fats. He stresses that going to the doctor should be part of a broader approach to health that prioritizes personal responsibility and informed decision-making. Dr. Dand shares personal anecdotes that underscore his convictions. He reveals that he has never had a primary care physician, believing he can better manage his health independently. He recounts his father's hospitalization and how he observed doctors being swayed by pharmaceutical representatives, quickly prescribing medication without considering other options. These experiences solidified his belief in the importance of patient empowerment and critical evaluation of medical advice. Dr. Dand's message is a call to action for both patients and healthcare providers. He urges us to work towards a healthcare system that prioritizes patient well-being, informed decision-making, and preventative care. His video serves as a powerful reminder that our health is ultimately in our hands, and that by being informed and engaged, we can navigate the complexities of the healthcare system and strive for a healthier future.